I will be talking about my field work practice. So the title of the assignment was Field Capstone Learning Presentation. And as you can see, you have my name, the date, and the subject and professor. This semester I did my fieldwork practice in care transition at UAB Hospital. Um, there we have several units that we work with. So it's social service all together. You can like during my field practice while I was there, I was able to go to oncology radiation, the dialysis clinic, the Kirkin Clinic, just throughout the Kirkin Clinic, to PT, dealing with all varieties of patients. I was able to work through my practice at the Whitaker building, at a doctor's office, and I was also able to work with the step down clinic. Um, so the mission of care transition is they basically want to provide evidence based off the coordination and the education that they give to the patients. So basically, the the results they get from like the different patients that come in, like from say their biggest thing is to avoid readmission to the hospital. And so whether that's like providing the medicine that the patient need, providing treatment that the patient needs, just a variety of things, they trying to prevent readmission into the hospital. And sometimes you can't do that, but that's what they're trying to do. Because patients have, different circumstances. Um, so with care transition, they have a couple words that cinnamon that they go by. So safety, they want to make sure that the patient is safe, they feel safe and receive um the care that they need in a safe manner, and make sure that they don't feel like anything like that is alerting them basically. You want to do it in a timely manner to make sure they get the best care they need. So basically take action when you find out that the patient needs assistance, to give them care effective. You want to make sure that you're giving them the right resources. You don't want to give them resources that they don't need, or resources that's not going to help them with their care. And that goes, and then efficient. You want to make sure that it's not out of the patient's range. Like you want to try to support the best way you can without causing difficulties. You're here to basically provide the best care for the patient. Um, and you want to make sure that everybody receives equal access to the different resources. So during my practice, social work practice, I was able to gain valuable hands-on experience with documenting, doing prepare assessments, visiting patients to explain the procedures and what's going on, and provide resources. I was able to send out referrals, communicate back with the different agencies, like one of the agencies called Hope Lodge. I did that with the oncology patients. Dialysis, I was able to talk with DaVita, and for Cerner, stuff like that. That's basically what my practicum consists of, in documenting, like I said before. In my competency 3, I was able to identify systematic barriers that affected the healthcare system. For example, one of them was that like the pharmaceutical companies, it was where the patient, like for say a patient had diabetes, their insulin medicine was like $300. I'm just gonna call it a number, $300. And for us, we was able to get it for like $10. So it was times where if the doctor wrote that order, we could help out by purchasing the medicine for the patient and just giving it to him from the doctor, the physician, the PCP. Competency 3. Not 3. I'm sorry. 6. I basically was able to like meet. We had something called huddle, and so when I was working on the dialysis unit, we would meet on W8, and we would go to huddle, and it would be 2 nurses. There's a part of the care transition team, a physician, a physical therapist, and 2 social workers. One was a case management worker, and the other one was the social worker. Throughout my internship, I have gained a lot of necessary information, valuable skills that will help me like document and be able to complete assessments, being able to send referrals, being able to find referrals, being able to know how to advocate for my patients properly, and I was able to network with different agencies, and I think that's extremely important in social work. My next step after after I graduate, of course, to my BSW, I plan on going back to school. I actually want to be a nurse. I'm going back for my MSN at Emory University, but I also want to incorporate my MSW. So I plan on trying to use that together once I become an NP, and open up my own practice, to be able to assist people with like resources and also give them the care that they need. But besides that, that's what I plan on doing. And the semester was great with my internship. I hope you guys enjoyed it. Bye.